is definitely running.
Hello, Dr. David McFadden from the Dental Implant Center in Dallas, Texas. Thanks for joining us today. I always start by showing you a picture of the office. Still don't know why, but this is where I work. So the topic today is what they won't or don't tell you about the All-On-4 procedure, full mouth dental implant treatment. So this idea of the video came about because I was getting so much feedback from new patients who had found me from my original video called Buyer Beware, Problems with All-On-4. I recorded that YouTube video about 4 years ago. It's approaching 100,000 views, so thank you for that. But in that video, I disclosed 7 things about the All-On-4 process or protocol that I do not like. I don't do All-On-4, and that video will tell you every reason why. But the feedback that I got from so many of you was these 2 issues in that video. Of the 7, these were the 2 that people really focused on the most, and I agree. The massive bone removal, unnecessary and very invasive. And then the design of the prosthesis is not cleansable. The patient cannot clean the prosthesis in their mouth. I'm going to show you some examples of all this. But first off, I wanted to say I'm not a lawyer, so I'm going to give you some legal descriptions or definitions here in a minute that I just simply found by looking online. I'm not a paid actor either. I am Dr. McFadden. So I want to go through, and the only way that we can communicate, right, as human beings is if we have a shared language and we understand the definition of words. So one of the big problems with the process, even before the All-On-4 process starts, is the consent. Informed consent, by definition, is permission granted in the knowledge of the possible consequences, typically that which is given by a patient to a doctor for treatment with full knowledge of the possible risks and benefits. Pretty simple. It's basically you're telling me that I can do this procedure for you. But I've got an issue with this when it comes to the All-On-4 consent form. And I have a number of them here in the office. I've had patients bring them to me. Some you can find online. And I have insider knowledge also. But the issue I have with it is the original definition doesn't talk about disclosure of the procedure, but I believe it's implied, meaning you can't give somebody full knowledge of your risks and benefits if you don't know what's about to happen to you. So you have to understand the procedure that you're signing up for to have full knowledge of what your risks and benefits can be. So I don't think it's even a loophole. I think, so it brought me to a definition that I came up with myself, misinformed consent. And that is, this is my definition, again, I'm not a lawyer, but the purposeful omission or downplaying of descriptions of recommended procedures to limit the patient's understanding of said procedure. So if you don't understand the procedure, you can't consent to the risks and benefits and consequences. The 2 have to go together for it to be, I think, a fair legal document. So how does this apply? So in those forms and in the consultation, patients are not told about the massive bone removal. Why do you think that is? If you don't know about the bone removal, all you're thinking about is getting a beautiful smile and being able to eat normally again, right? That's all you're thinking about. But if they don't talk about massive bone removal, there's less chance of you saying no, or there's no chance of you asking questions about it. So clearly, the omission of the disclosure for bone removal is to increase case acceptance. They want more people saying yes. So if you guys know of a consent form or you have had the procedure done and you were told about that, I'd love to hear about it in the comments. But I've reviewed these cases myself, and I can't. All 3 consent forms that I reviewed, they actually talk about bone grafting. All 3 of them, bone grafting, not bone removal. Again, I think it's smoke and mirrors. Excuse me, I think it's a diversion or a deception of some sort. So let's get into the massive bone removal. What exactly do I mean by that? What I mean is they're going to remove a 1/2 inch of bone from each jaw, or 1 inch total. And these are not numbers that McFadden made up. These are numbers that you can find in the literature. You can find them on lab prescriptions. You can find them in surgical notes. This is what they think they need to make a prosthesis for you that is large and strong. Again, I think this is antiquated etiology. I've been doing these treatments for 34 years. They don't have to be this thick to work and be a long-term success. So I know this is gory and gross, and you might want to click past it, but this is an actual picture of an Instagram post where a doctor was bragging about starting his All-On-4 Friday and how fast he could remove the patient's bone and teeth. Patient's numb and sedated, the tissues are reflected or elevated, and the reciprocating saw is used to cut the teeth right through the roots and the bone all in one shot. So I don't know, that's 10 or 12 millimeters at least. I don't know. But I want you to, not that you could ever forget this picture, but this is not disclosed. The patients don't know this is about to happen to them. So, it leads me to some more definitions so that we can communicate accurately. Alveoplasty, recontouring or smoothing of the dental bone, usually a sanding or burnishing of the dental bone to remove irregular contours. If a patient was getting full mouth extractions and we were putting dentures in, we would smooth everything down where the bone is at a peak between the teeth. There's a little peak between the teeth that we can take down very easily. At the most, you're talking 2 to 4 millimeters, and that's arguable. People would say that alveoplasty encompasses all bone removal, but it's not accurate. So the more I thought about this, the more I realized that the accurate word is alveolectomy, the removal or the gross removal of bone to create space for that thick restorative material, and basically cutting away large pieces. You can use pliers, you can use a grinding burr, or you can use a reciprocating saw. Does that even seem right? Any of those words? Pliers, grinding burr, reciprocating saw, does it even seem like those are words we should be using in dental treatment? The oral cavity is small. Dental bone is usually at a premium. We don't want to be removing bone. So I just got smarter today. My marketing friend here, Barb, she knew all this and never disclosed it to me. But I didn't know when YouTube creators were saying, we'll provide the link below. I didn't even know what that meant, and I'll bet you some of you don't either. But there's a description box below the video and below the thumbs up and thumbs down symbols that you can click on if it says more, and we'll show you how to do that. That's where our videos are going to be. They've always been there, I just didn't know where they were. So I'm smarter today by a little bit. So what I did was I went to YouTube and Google, both, and I searched for terms like bone removal for dental implant treatment, alveoplasty for dental implant treatment, bone removal for All-On-4, alveoplasty for All-On-4, alveolectomy for All-On-4. Every search phrase combination I could come up with, and I came up with 3 videos. Now, there have been tens of millions of All-On-4 done in the last 15 years. And there's 3 videos where doctors are, well, 2 videos where a doctor is sheepishly trying to describe bone removal, and then the the middle video is a corporate video from Nobel Biocare, one of the two biggest implant manufacturers in the world. So in the first video, what I want you to pay attention to, and please, please go look for these videos because it's very important. Well, this decision is very important, so this is a way to educate yourself. So what I want you to pay attention to in the first video is the doctor renaming the bone removal words. See what words he's using instead of actually saying bone removal or alveolectomy. The second video is the corporate video where at the very beginning there's a little text line at the bottom, and what it says is All-On-4 is a treatment for edentulous patients, meaning the All-On-4 treatment is made for people who are already wearing dentures, who have already lost their bone. And then this third video, the doctor's talking about bone removal and showing massive bone removal while trying to downplay what he's doing. He even mentions that he's going to use some of that bone later for bone grafting. And if he does, I think he may even use like 2% of it to graft a little hole in the bone that probably didn't even need to be treated. But these were the only three I could find. And if any of you can find others, I'd love for you to let me know. But the ratio of number of All-On-4s completed, which is in the tens of millions, 2 treatment videos where doctors are willing to even talk about bone removal. So, I guess the basic thing I'm saying here is that you as a patient deserve to have disclosure accuracy. You need to know what's about to happen to you and to what extent. You don't have to see gory pictures of it. Nobody has to invite you into a surgery to watch it, but you have to know what's going to happen. And my issue here is we actually have disclosure inaccuracy, purposeful disclosure inaccuracy. And that's what you need to, if you decide to go for an All-On-4 consultation, ask the question specifically, how many millimeters of my bone are you going to remove? And just know that 15 millimeters is about a half an inch. So what I found in these videos, which I think is incredibly deceptive, is that they're changing the words. The verbs that are being used to describe massive bone removal are the soft side, right? They're going to smooth your bone, they're going to flatten your bone, they're going to contour or recontour your bone, or they're going to level your bone. So just so you know, and even if they don't call it All-On-4, if they call it All-On-4, All-On-X, or they have their own name for that treatment, 24-hour smile, tomorrow's teeth, whatever they call it, I'll translate these words for you, just so it's clear. Your bone's going to be removed. So whatever word they're using, here's your translation. All of it is going to result in massive bone removal, no matter what word they use. If you don't believe me, here's another slide that you've seen right out of a corporate lecture at a dental meeting. Reciprocating saw, removing 15 millimeters of bone. Alveolectomy, that is the only accurate word, scientific word for the process. So I'm going to let you watch this video twice through. I had it made just to give you an idea, and then we'll go through each segment of it and describe what's going on. So start with a person that has all their teeth. They take out the teeth first. Then comes the massive bone removal and the implant placement. And then you get these huge zirconium or titanium acrylic prostheses on them. So let's go one at a time. Now most of you don't have all 28 of your teeth, but some of you have 28 roots or 15 or more teeth. So many of them might be broken or decayed, or you might have some bone loss around them. But if you have some or all of your teeth, you are not a good candidate for All-On-4. There's a much better way. I've talked about that for years in my videos. An implant bridge will replace the teeth that you're missing without losing all your bone. So here's a person that has 28 teeth. They have problems with them for whatever reason. The teeth are removed, and the next step is this huge bone removal. Basically taking away 15 plus minus millimeters here and 15 plus minus millimeters here, placing implants. This is a good point for me to reiterate too. It doesn't matter whether it's All-On-4, All-On-6, All-On-8, All-On-X. It's all the same. They still have to do the bone removal to perform that protocol. So don't be misled by that either. And the prostheses are twice the size they need to be. And again, I've gone into why in other videos. I'm not going to go into it today just to try to make a long video a tiny bit shorter. So a real life case. This patient came to see me. She wasn't happy with her All-On-4 outcome. But what's remarkable here is that I was able to get her preoperative panoramic x-ray. I already had her post-treatment x-ray, but I wanted to see the comparison. So 30 or more millimeters of bone in her upper jaw. That's before she was treated. Now look at her. This huge area of bone removal. She now has 12 millimeters of bone. So I'm not that good at math, but 30 minus 12 is 18, right? 18 millimeters of bone removal. And this big, huge, well, it doesn't look that big, and you're about to see why it doesn't look that big. So this lady signed up for permanent teeth in 24 hours. We'll talk about that a little bit later too. And here's her result. Imagine thinking that you're going in for this life-changing procedure with 30 millimeters of bone. You come out on the other end, 18 millimeters of your bone is gone in each arch, 36 millimeters, over an inch. They gave you teeth so fast it didn't even give the bone and the tissues a chance to remodel. You now have this huge void between the prosthesis and your gums. Imagine how much food is stuck in there every time she eats. So patients like this end up in my office asking me for a solution, and we can improve her situation. We can make much better prostheses, and we can close this gap, but we can't unring the bell, right? We can't put the bone back, unfortunately. So I want you to notice, though, if this is maybe, I don't know, 5 millimeters or so here, think about if you cut yourself by accident, you cut yourself with a knife. How long does it take the soft tissues to heal till you can't see the scar anymore? Months until you can't see the scar, but at the very least, it's probably going to be 2 weeks that you're going to see the cut as it's healing, right? That's just soft tissue. Bone heals much slower than soft tissue. So when you hear about getting teeth in 24 hours, run. Now, some of those offices will tell you, well, we'll come back in 6 months and we'll close the gap. Okay, well, that will make it a little bit better. They're not giving you your bone back. And in this case, this lady has a metal bottom on her prosthesis, and the implants are now above the gums. The abutments are above the gums. So even if they were able to come back and add some material to close the gap, they're going to create a more uncleansable situation here because it's going to be a funnel around that tooth. I call it the cylinder of uncleansability. There's a video on that too if you want to look for it. But not only did her bone suffer from this surgery, her soft tissues have suffered too. This nice pink tissue that she had an abundance of before surgery, she now only has remnants of that tissue. And this red tissue is not good tissue to be around the implants. But this is not atypical. This is not what they consider a train wreck. This is a perfectly acceptable All-On-4 outcome. And the only thing I can say about it is that she can clean it. After she gets the meal out from underneath the prostheses, it is a design where she can get a water pick in there, a brush in there, and some floss in there. But that is a small consolation for an outcome like this. It brings me to my next point, and I've got a video that we'll link below in the description box. Lips retracted final pictures. If you go to my gallery, every one of my 100 cases has lips retracted before, during, and after. Not one, I can't find one All-On-4 gallery or case presentation that they're presenting to the public with the lips retracted. Why do you think that is? I'm sure by now you already know. But let me tell you that when you're taking a board exam, in any of our specialties, or even our sidebar specialties, we have to show lips retracted before, during, and after pictures. That's a part of the dental training process. That's a part of the board examination process. And that's a part of full disclosure. Why do you think the All-On-4 offices don't show you any lips retracted? Do you think maybe? You think maybe it's because a lot of them would look like this? Absolutely. Even the good ones. And I'm going to show you a good one. Believe it or not, you heard it here first. McFadden's going to show you a good All-On-4 case. It's still not a success, but it's the best one I've ever seen. So I want you to think about that too. They're hiding something. If they're not willing to show you lips retracted photography of where the prosthesis meets the gums, they're hiding. They're hiding that for a reason. They're not proud of it. They don't want you to see it. So that brings me to the second part of my rant today, is the cleansability. Some of that relates back to the surgery, not all. It's a flawed protocol, and I'm about to show you. So more likely the complaint is uncleansability, the inability to clean a dental prosthesis in the mouth. So that's really what we're talking about. So since the beginning of All-On-4 in Portugal 20-some years ago, and in the United States 15 years or so ago, the doctors allowed or instructed the technicians to make these prostheses concave. Look, it's very pretty before it goes in the mouth. 3 months. And I would argue that it was probably like this in 3 weeks. Rotting food, plaque. A combination of plaque and rotting food is called material alba. But you name it. It's nasty. So here's a person who maybe spent tens of thousands of dollars on their mouth. Can you imagine the bad breath, the halitosis that he may or may not be aware of, but everyone around him is aware of? So just a different view of the same thing. It's three-dimensional. It's so gross and so nasty. So this was when I came up with the concave versus convex design, is that I went in for this patient and made the concave into convex by adding and subtracting. I took away the edges on the inside and outside, and I added acrylic to make it convex. So now at least he has a fighting chance. There's no safe harbor for the food and bacteria. So that brought me a few years ago to talk about this concave versus convex issue with these dental prostheses. And so a lot of my patients come in quoting me on that. I want convex, I want convex. And I was like, well, you're in the right place because that's all we do here. Anyway, so just to give you a better idea, here's a concave design. Anywhere that superfloss cannot get, you'll never be able to clean in your mouth. I don't care if it's a brush, it's a water pick, it's floss, there is no cleaning it. So concave is bad, and we've always known it was bad. Since the beginning of implant dentistry 40 years ago, we knew concave was bad, but yet this is what they do every day, every patient. So here's that good All-On-4 case I was telling you. At least it's as good as I've ever seen. And when you look at it with lips retracted photography, Yes, you see the pink acrylic here, and you see some pink acrylic here. Nothing jumps out at you. Show you the lower. You start to see a little bit of food and material alba, a little bit of inflammation. So we take the prostheses off, and you do see food and trapped plaque, lots of plaque and food here. The tissues are okay. There's some inflammation here, and I'll show you the lower. The lower looks good too. Some food here and there, some plaque here and there. The tissues are fairly healthy. So as good of an all-on-4 treatment as I've ever seen, but do you think she signed up for concave so that she can't clean the prosthesis? Again, that wasn't disclosed to her. But the reality is that's the only way they make them. And anytime your margin is above the tissue, that's going to be an uncleansable area 100% of the time. But in general, this is the problem. They're designing the prostheses, and again, I said the best one I've ever seen, still a failure for the patient, food and plaque everywhere. No way to clean it. Virtually no way to get that clean. That's the upper, this is the lower. It was actually worse than this. I started cleaning it with some gauze before I got the idea to photograph it, but imagine your spouse, your significant other, your friends, bad breath is bad. That's why it's called bad breath. So all those centers talked about a lifetime warranty. But now so many patients have come back with problems, especially the problem with not being able to clean, that it's now a limited warranty, which I never believed in the lifetime warranty anyway. Yeah, you can replace an implant that fails. You can make a new prosthesis that can't be cleaned. You can continue that cycle of insanity, and it's called a lifetime warranty. But if the protocol is flawed from the beginning, you're just getting a lifetime warranty on flawed goods anyway. But now, because of all the cleaning problems, these offices, many of them, are telling you that now to keep your warranty, you've got to come in for a cleaning one or two times per year. That's the prosthesis is removed and cleaned, and you're charged $500 per prosthesis. So that's $1,000 to $2,000 a year to keep your warranty. But how long is it going to stay clean? A few days at the most. So whether you go once every 12 months or once every 6 months, and they charge you this fee for removing and cleaning the prosthesis, as you saw in the previous pictures, it's only going to be clean for a few days, and maybe even just a few meals, maybe one day. So flawed design, flawed etiology. So back to the concave versus convex. The problem's not unsolvable if people would just stop and consider the outcomes, consider the results. What am I seeing today that I've seen 100 times, and how can I fix it? I don't know why they can't think like that, but they don't. So when I say convex is all we do here, that's all we do here. So rounded at the top, so floss can slide over the top of it. And to be honest with you, we believe the flossing rate in our implant patients is only 30%. But the tissues that we develop with the convex profile are amazing. Even a patient who's already lost a lot of bone and has to have some pink prosthetic material, that still has to be convex so you can clean it. So they're now taking these prostheses out once or twice a year. I've been doing these types of bridges for 34 years, and we never take them out. The tissues are pink and healthy and beautiful, and we never take these things out for cleaning reasons. We might take them out for mechanical reasons. Every once in a while, a little screw that holds the prosthesis in gets loose, so we take the whole thing out, put it back in, put new screws in. So it's kind of like a service call, a service appointment, but we never ever take them out for cleaning reasons because they're properly executed surgery, no bone removal, and properly contoured prostheses. So I put this slide in of a lower back surgery to remind myself to talk about the significance of the decision that you're considering. We all have family or friends or neighbors who have had failed lower back surgery, right? We've got people that are limping, we've got people that are on crutches, we've got people that are in wheelchairs, and we've got people that are bedridden from lower back surgery. A lot of people sign up for lower back surgery without even vetting their doctors. Excuse me. But it's a very invasive, risk-filled procedure. And I don't want you to think about dental implant treatment, full mouth dental implant treatment, being any less invasive or risky. It's something that you should search real hard to find the right doctor. You should understand your procedures intimately. You should go on All-On-4 forums. You should Google implant bridges. That's the word I use because I didn't want to come up with my own trademark name for it. I felt like it was just egregious and I was going to be one of them if I did it. The McFadden Fast and Furious Bridge or the whatever. It just, I can't. So implant bridges. You'll probably get all my videos. But this is perhaps the biggest medical or dental decision of your life. It probably, for most of you, is the second largest financial decision of your life. And you want it to last the rest of your life. You want it to be easy to clean. You want to know you did your research before you take the plunge. So think about it and research it and understand it. In closing, I'd like to show you just 4 of my hundreds, if not thousands, of cases like this. 0 bone removal, implant bridges. This is the patient's own tissue. That's not prosthetic zirconia or acrylic. That's case 1. This is case 2. Here's 3 and 4. I've got many more on my website in my gallery. Someday I might try to do a video to show you hundreds of them at a time, but this is what is possible for those of you with some or all of your teeth and most of your bone. You don't even have to have all of it. You may have a little bit of bone loss, but you don't have to have all of it. Some of these structures will come back with a properly designed temporary, followed by a properly designed permanent prosthesis. This is what we do here. This is not just that one case that turned out perfect. So I wish you luck in your search. I beg you to dive into this completely. Just think about what you're signing up for, know what you're signing up for, and once you finally are in that office for your surgery, know that you've done all you can to educate yourself to prevent a disaster. Thank you very much.